So here's the situation. My friend Mo messaged me saying that she injured her knee playing football last week. She caught the ball, was about to make a move, planted, twisted her knee, and felt a click. It rotated towards the left?
Yes.
Okay, and then you felt a click or a pop?
Yeah, I felt it pop.
Was there sharp pain at the time it happened?
No.
Okay. Does it feel more on the surface level or does it feel deeper in the knee?
I don't know, to be honest.
Yeah.
I feel like surface, but then when my RMT acupunctured it, it felt pretty deep.
Okay.
So.
And then did it swell up like a balloon afterwards or
no.
just like a
Honestly,
mild swelling?
It's just mild swelling.
Okay.
And mainly just around this area.
Okay. All right, I'm going to check a few things here. So a couple of things, I think RMT was saying MCL could be a possibility.
Mm-hmm.
Other one that could be is also the ACL because of the way that you pivoted.
Mm-hmm.
Okay, so we're going to check a couple of these here first. She showed me range of motion, so extension looks pretty good, right?
Yeah.
Any pinching or discomfort with that?
No.
Okay.
No.
Can you bend it in as far as you can?
Yeah.
Any pressure with that?
No.
Okay. And it's Sunday you had it, right?
Saturday.
Yeah. So it's been 3 days. So that's actually pretty good range of motion for a few days. Okay. So the other thing we're going to check here is just joint line tenderness. How does it feel right on that? So medial joint line.
I don't know. It feels normal.
Okay.
Okay, now it feels tender.
If I compare that to your right side or your left side?
Can you do it again?
Yeah.
Nothing. I don't feel anything.
Same?
Yeah.
Okay. So right on the MCL here, that feels okay. So the other thing we could consider is the kind of like the medial retinaculum, which is that tissue that connects your kneecap to your knee. How about that?
Oh, okay. Yeah, that kind of feels uncomfortable.
A little bit uncomfortable there? Have you ever dislocated your kneecap before?
Yeah.
You have?
Yeah.
How long ago?
In high school.
High school?
But it went like all the way here.
Oh, gross.
Yeah, I was lying on the ground.
Did it feel like it was coming from the kneecap this time around? Or did it feel deeper than that?
No, it didn't. Honestly, when you did that, it did feel pretty uncomfortable and like...
Okay. So another one we can do as well is the anterior drawer. Do you ever feel like... Have you ever done your ACL before?
No.
Okay. So I'm just going to pull your tib forward toward me. That feels okay?
Yeah.
So it's a nice firm end feel. And we can compare that to your right side. So just looking at any kind of excessive movement. Feels okay?
Yeah.
Yeah, another one we can do for the ACL. So a couple of special tests with the ACL. Okay, relax here. I'm going to yank your leg, okay?
Okay. Yeah,
you know this one?
No.
Okay. So I'm going to just pull. You feel that little clunk?
Yeah.
Yeah, so that means your ACL is still there.
Oh, okay.
Which is good. Yay! Okay, so it's probably unlikely to be your ACL. So the other one we're going to do here, so I'm going to crank your knee this way towards me, okay? How's that feel?
It's fine.
No pain?
No pain.
Okay, I could do a straight leg one as well. That's okay?
Yeah, that's fine.
No pinching or discomfort with that?
No.
Okay, that feels okay?
Yeah, that feels okay.
Okay, so MCL seems to be okay as well. Okay, so ACL seems to be okay, MCL seems to be okay. Okay, I'm going to do this with your kneecap.
You do this thingy?
Yeah.
Like this? Yeah, it's fine.
Yeah?
It's very loose compared to my other one, so...
Does it feel like it's going to pop out?
No.
Does it feel uncomfortable at all?
No. My kneecap's so tiny.
Well, I mean, how's it feel right in there?
It does feel
Tender?
uncomfortable there, yeah.
Okay. Is it more tender here?
In the inside.
Or is it more tender here?
Higher.
The first one?
Yeah.
Okay. So we're looking at more of the, probably the medial retinaculum of your patella there, okay? So that's probably what it is here. It doesn't look like your MCL is involved, which is a good thing.
Okay, good.
Okay, so you felt a little bit of a click, you felt a little bit of swelling that day, and then you were able to move afterwards, but if you just feel unsteady a little bit.
Yeah.
Okay. So yeah, it definitely sounds like your medial retinaculum of your patella.
Okay.
And you've had dislocations before?
Yeah.
Just this one or both sides?
Yeah, just the right one.
Okay. But it's been a while.
Oh, yeah. 10 plus years.
Okay.
Oh my God, how old am I? Yeah, 10 plus years.
Almost 40, right?
No, I'm not. Yes.
Okay.
Nothing wrong with that.
What's that? Nothing wrong with 40? Yeah, no, I'm still
So
5 years
yeah, I
old.
do this to my knee. I mean, compared to like, and I'm trying to relax it, it definitely gives...
More?
Yeah.
Like more now than before, or
No,
even
this
even
is how
before
it
that?
usually
Okay.
is.
Yeah. So we checked your MCL, it looked okay. We checked your ACL, looks okay.
Okay.
So it's probably like so basically what the retinaculum is like these ligaments that connect the inside of your kneecap to your femur, okay? Yeah. So it's like tissue, almost like a Yeah, just like any other joint, right? So basically when you rotate it that way, it probably pushed your kneecap this way. You probably felt a few clicks. You're probably hypermobile already, so that's going to cause it to increase the likelihood of kind of spraining. Doesn't look like too bad. It's only been 3 days of it, okay? So a few things we're going to work on here. We'll do some treatment on here to help you loosen up the knee a little bit. So what we want to do is, because obviously the ligament, we can't do anything to it realistically. I mean, you just give it time to heal and it'll kind of form its bridges again. But what I want you to do is I want you to strengthen your quads. So you can do like leg press, squats, stuff like that. That is like unilateral movement.
Yeah.
So that this helps to kind of support the kneecap.
Okay.
Yeah. So it's nothing serious.
Yeah.
Give it a few weeks. If you want to play, you can probably play with a knee brace on. Otherwise, just strengthen the quads. Give it a few weeks, and it should be okay.
Okay.
Yeah.
Great. Okay.
All right. We'll do some treatment on it, though. Okay.
Now
that we kind of point out that area, does it feel like that's where it's coming from?
Yeah, I feel like that makes
more
sense.
so than like the other parts of the knee, right? Okay. So I'm just gonna do a little bit of release on your quad then, and then we'll go from there. Yeah.
That feels good.
Yeah. So basically, what's gonna happen?
I was flexing my foot.
Okay.
Basically,
what's going to happen is after any kind of injury, the muscles surrounding the joints, so like your quads or your hamstring, it's going to start to tighten up to protect the area. I mean, you're going to be like, oh, why do we want to loosen it then? But it's going to be a little bit tight after it's like a guarding mechanism, right?
So do you think that there's no point in me going to the doctor tomorrow? Okay, yeah.
They're going to be like, oh, go for physio.
Yeah, okay, cool.
Yeah. Tender?
Yeah.
Don't worry, I won't needle you today. Not your quad anyways.
Oh, I mean, you can if you want to.
That's okay. You don't need it. Your quads like quaking.
Yeah.
Okay. So a couple things you can do for this actually would be just to kind of, like continue doing your kind of
I'll relax.
manual shifting back and forth.
Yeah.
Just get some mobility through the kneecap. But like I said, even if you don't go to the gym, you can just do some like split squats.
Yeah.
You know that one? Yeah. So do that to strengthen up your quads. Do a little bit through your glute as well.
Split squat?
It's like a lunge with your leg on top of the.
Okay, that's what I thought.
Yeah. Okay, relax this leg for a sec. Okay, relax. I'm going to dig into your glute here.
I am relaxed.
The medial retinaculum of your patella. Medial retinaculum. Retinaculum. R-E-T-I-N. Retin. A-C-U-L-U-M. Retinaculum. I'll show you a picture in a sec. Yeah. So there's like a bunch of ligaments that kind of help support your your kneecap. So it pretty much holds it onto the femur. Yeah. Yeah.
Okay.
Yeah. And that's usually what gets damaged when you have dislocation, because it stretches it so much that it's no longer able to keep it in place. How'd you get it back? You have to go to hospital for that?
Yeah.
Yeah. What were you doing?
Basketball.
Oh, man. But you know what? I think that's probably the better of the
injuries.
Yeah, that you could sustain from that kind of motion anyways. Was that one of the three that the massage therapist was talking about? It's a long word.
It's such a big word that you're probably,
Yeah. ACL, MCL, and meniscus were probably the other three that they might have mentioned.
Yeah. So I was already hopeful.
Well, I mean, it's a good thing that you're already walking around, right? That's the big thing. Okay, have a sit up. I'll show you on the picture here. Yeah. Okay, so kneecap. Okay. And then you have tissue that comes off to the side like this.
Yeah.
And if you look over here, the medial patellar retinaculum is like this stuff here that connects that.
Yeah.
So when you rotated your body this way, it pushed the kneecap that way, and it stretched everything on the inside here.
Okay.
So that's what you're likely injured.
Yeah.
Okay. MCL is like another one that sits right here where the green line is. But that's unlikely to be the one because it feels pretty stable, and we did the testing. It doesn't look like anything too uncomfortable. ACL says deep to that, you know the ACL, right?
Yeah.
So deep inside the knee. Again, same thing. You have, when we kind of did that yanking test, it seemed to be present and it didn't seem to hurt. And then it also felt strong in that area. Okay. That's the other one that we're thinking about. But otherwise, your joint moves fine. Like medial meniscus is another one that could be injured on this side, obviously. But again, joint movement looks fine.
Okay.
Swelling is really minimal. So quite tender right on the inner kneecap. That's probably what's going on. And you had a history of it too, so that's probably what's happening there.
Okay, yeah.
Nothing to be concerned about. Give it a few weeks. If you want to get back into sport, you probably can with a brace. If you really necessarily have to. Otherwise, a few weeks, just strengthen your quads. It should be okay.
Okay, great.
Easy peasy?
Yay.
Excellent.
And then, so should I, tomorrow, or like, should I come to you and get it like needled and stuff and worked on
For the
often?
For the quad?
Yeah.
If you want to, so for something like this, if you just give it time and just strengthen your quad, it should be fine.
Okay.
You don't have to get any like passive treatment for it done.
Okay.
If you want to, because let's say, like I said, because you're gonna get a little bit of guarding, a little bit of tension through the knee because of the injury. If you feel like the massage or the needling helps to loosen that up, and then it just feels comfortable, and that's something you can do as well.
Okay.
Is it necessary? No.
Okay.
Yeah, that answers your question.
Okay, great. Yay, that's great news.
Yeah.
Thank you.
No problem. Thank you, Joe. Well, there you have it, guys. If you guys found that content interesting or useful, consider subscribing to this channel, and I hope to see you guys in the next video. See you later.